very small degrees of instability between these structures, between each motion segment. Okay, so between each motion segment. Now we have micro instability here, and that then exposes you to the risk of little micro tears, which are extremely painful. Good evening, everybody. How you going? It's David Johnson again, and for another little chat about back pain and spine health. What I want to talk to you about today is something that really isn't well described in the literature, and certainly not available to patients to search up about extensively on the internet. It's called micro-instability. Micro-instability. Okay, now what do we mean by micro-instability? Well, I'm going to play a little video a little bit later from a colleague of mine who I speak to from time to time, whose name is Professor Stuart McGill. He's a biomechanist that works in Canada, professor of biomechanics in relation to the spine. And his video is quite helpful in getting our message across about micro-instability, because he's done quite a bit of research on this topic himself, and also is one of the first people to perform a video fluoroscopy, or a moving X-ray of someone developing a acute back injury during a lifting task. So when I'm talking about micro-instability, we are talking about movement of the spinal motion segments. Okay, so if we think about Bones here, who has vertebrae, and you can see them lined up on top of each other there, and each vertebrae is separated by a disc. And if we're talking about the lumbar spine, we can draw in, we can draw in 5 lumbar vertebrae, and then we come down to the sacrum. Okay, so that's the sacrum, and we can go 5, 4, 3, all the way up to 1 for our lumbar spine. And the message that a lot of people are putting out there, that the spine is a very strong and robust structure and resilient and resistant to injury, is only partly correct. And what people are not putting out there in these sort of infographics and things like that is that the spine can very easily be injured if you damage these collagen fibers and soft tissues that live around the bony structures. So not only of the discs, but of the joints that are situated at the back of the spine as well, because don't forget that we have joints that live at the back of the spine too, and these are called our facet joints. And all of these structures are covered by fibrous tissue and collagen tissue and cartilage that are very densely innervated with nerve receptors. Okay, we have lots of nerve receptors in these structures, and if they get injured, they will deliver pain, and we've talked about this in previous lectures, through the processes of nociception and inflammation. Okay, so the trick is to try to minimize the activation of nociception and inflammation. And how do we do that? Well, we want to prevent micro-instability from occurring, and the spine is only robust and strong and powerful if it is moving correctly. If the spine is not moving correctly, you are going to experience the consequences of this micro-instability and activate these nociceptors and inflammatory changes in the soft tissue paraspinal integrity. So if these motion segments which I've drawn here, okay, I've drawn a couple of motions, I've drawn 2 motion segments between this bone and this bone, that's one motion segment, and this bone, that's another motion segment. If those joints, that motion segment, that joint between L3 and 4 and L4 and 5 are not moving in a coordinated, functional way, they will be prone or susceptible to micro-instability and injury, okay, structural injury. So if we want to minimize the risk of someone developing a structural injury, we need to eliminate this susceptibility to micro-instability. So the only way to do that is to ensure that our nervous system, our central nervous system, is in control of all of these muscles that live around our spine, okay, and that make up our abdomen and pelvic floor and diaphragm up here, which is what we call our core stabilizers. They make up our core stabilizers, okay, and that's like a big air balloon, okay. Think about a big air balloon in front of your spine that's keeping it stable, and then of course we have all the muscles at the back of our spine that's keeping it stable as well. And if we have a central nervous system that is coordinated at controlling those muscles, then when we move our body doing just normal everyday life activities, or if we move our body doing very heavy physical demanding activities like picking up bags of concrete or digging holes or pulling out tree stumps, these bones will be moving in a very harmonious functional way without micro-instability. And that means that they stay in very good alignment. Okay, they stay in very good alignment. So even if we are curving our spine, so I might just rub that off. So even if we are curving our spine, for instance, they still follow this nice, smooth and coordinated curvature, okay? As opposed to micro-instability, oh, I should have left that up there. As opposed to, I'll leave that up there. So here's nice smooth movement with the spinal segments moving in a very coordinated, functional way, minimizing the risk of injury to these little discs here, which are not very strong. Let's face it, these guys are not very strong. It's the support that is strong, not the actual disc. Okay, so that's a coordinated way, as opposed to a spine that is not coordinated and moving in a somewhat, I'm going to just draw this line a bit differently, a somewhat discoordinated way, with the bones slightly unstable on a microscopic level, very small degrees of instability between these structures, between each motion segment. Okay, so between each motion segment. Now we have micro-instability here, and that then exposes you to the risk of little micro tears, which are extremely painful and which the body then protects by making your muscles go into tight spasms and trying to resist the activation of these nociceptors, and that's what gives people the sensation of back spasms, okay, because the body's going to try and protect you from these injuries that have arisen as a result of repetitive micro-instability. And it may not be the first time that you move poorly, but accumulatively over months and years, you then develop further weakness, and then all of a sudden there's a smoking gun moment where you bend over to tie your shoelace or bend over to pick up your lunchbox, or very trivial activities, emptying the dishwasher. Very simple things like that have the ability to transform a spinal motion segment, which one day is not overly painful, not causing too many dramas at all, and then suddenly you're in debilitated agony and pain and disability. So that's micro-instability as compared to that. And
we were using video fluoroscopy, which is a real-time moving x-ray while lifters were lifting competitive loads. This had never been done before. We calibrated the range of each spinal joint from full flexion through to full extension. Well, as some of you may know, we filmed an injury, and this was the first time it had ever been reported in the medical literature. It's easier to see in this cartoon. This is the curvature of the spine with the lifter standing upright. As he bends forward through the hips, he flexed the spine slightly, which you see here, and then lifting the load about 10 centimeters off the ground, he dropped it and said, "Oh, I've hurt my back," which was an awful thing to happen. However, we went back and looked at the fluoroscopy records, and just at the L2 and L3 joint, just at that joint, that angle, it went to full flexion and past its calibrated angle of 1/2 degree. The rest of the spine did not move. This was a buckling event creating a micro movement. So for the first time 30 years ago, we saw that an unstable event or a buckling event could cause a back injury. And as we will see later, instability and micro movements causing pain at a joint are also the consequence result of injury.
The one other thing that's important to recognize is that as we age, the distance and height of the discs naturally decline. So when you're young, you've got really nice plump discs which have these fibers that look like this, these little cartilage collagen fibers, okay, that are like guy wires on a building or on a bridge that try to create as much stability as possible in the segment. So that could be L4-5 or something like that. But as we age, something happens to our discs. They lose water content, so they dehydrate and they become a little bit flatter. So these normally tight guy wires or collagen fibers sort of loosen up a little bit and become a little bit slacker. So now our disc is even more susceptible to this micro-instability, because you can imagine, instead of having nice tight fibers, you've got quite loose and flaccid fibers. So now these bones can slide in a very unsafe way with micro-instability that then can lead to a tear there, okay, and then the activation of all the pain processes that we've been talking about. It's actually very easy to maintain stable movement, but it requires an understanding of the things that we teach in the NeuroHab program, okay, and anyone who's done the NeuroHab program will understand this, because what we teach is neutral spine awareness, and posterior kinetic chain powered movement. Okay, and these two, and hip-centric rotation, as opposed to lumbar-centric rotation. Okay, so those three important and top three movement points of performance that we're striving towards learning allow you to develop the coordinated musculature that then transfers into preventing you developing micro-instability down the track. Okay, so the message is not, oh, don't ever round your back or bend your spine poorly. The message is move your spine in a coordinated way to prevent micro-instability and structural injury. But we only can get to that ability when we focus first on these three things, which is neutral spine, posterior chain and hip-centric rotation, which requires the understanding of that nice neutral spine position that I'm demonstrating there, and is why we use the foolhardy broomstick to learn about neutral positions, so that we develop the coordination and the musculature that then allows me to, if I need to, round my back away from the broomstick without micro-instability. But if I don't learn this first, I then expose myself to micro-instability when I do this. Okay, so that's the take-home message. It's misunderstood if people think that we're saying that you never round your spine. Of course we round our spine. If you sneeze, you're probably going to round your spine. But when we sneeze, we want to have the inbuilt coordination and muscular stability that then allows us to maintain that rounded position as I drew before, without the development of micro-instability and subsequent trauma, micro-trauma. But in the way you feel, it feels like there's a rusty nail in your back or something severe, but it's just a small tear that then becomes inflamed, and then the body responds with muscle spasms. Muscle spasms create even more bad movement, and more bad movement causes more inflammation, and the cycle goes round and round until you become extremely debilitated from your back pain. And all because no one has transferred this understanding of movement proficiency for activities of daily living. Okay, so a few concepts there. If you don't understand things in this regard, reach out to us, get in contact, send us a message. More than happy to help you, because the solution for the world's most vexing problem of back pain is extremely simple. Movement proficiency, functional movement training, and the NeuroHab program. Okay, thanks for watching. Bye-bye now.